Again, just to confirm that we have 5 cases currently in Fiji, and there have been no new cases. We are currently running our fever clinics right around the country. We have 37 fever clinics, and we encourage people with fever to attend so that you can get assessed and confirmed whether you have COVID-19 or not. As stated by the Honourable Minister, over the next few days, as we work towards opening up the border in Lautoka, there'll be increased activity from our health team in the greater Lautoka area. They'll be running mobile fever clinics. There'll be a lot of presence of health workers in the community, interviewing, assessing, talking to people, using thermal guns, visiting homes, and there'll be mobile clinics moving right throughout the greater Lautoka area as we work towards the opening of the restrictions that are currently in place. We are asking residents of Lautoka to work hand in hand with our health team to support us and assist us to get the coverage of the whole Lautoka community before we open up the borders, as has been indicated. We also continue with our contact tracing activity. Ministry of Health workers with the support of the military and police personnel, and we are going out and identifying and following up on all contacts of the cases that we have identified so far. As mentioned by the Honourable Minister, the particular case of interest of the New Zealand case that left Fiji on the 19th of this month and was diagnosed on the 21st. Our contact tracing team are out in the community, in Nandi, in Rakiraki, as well as Plantation Island, following up on his itinerary while he was in Fiji, and identifying all possible contacts and assessing them in relation to the fact that they are contacts of these patients. So far, the contacts, now a good number of contacts have been identified, and none of them have been found to be severely ill. We also continuing with our quarantine enforcement in all divisions of Fiji with the support of the military and the personnel. We have some 500 people under quarantine at the moment in home and designated quarantine facilities. And we are working hard, our quarantine teams are working hard, making sure that they are visited and assessed during the period of quarantine. And just to complete, we are working with divisional commissioners and our health teams in the division to set up a community isolation facility as per our preparedness and response plan. These isolation facilities have been set up in all of the main divisions of the country, and we are grateful to schools, institutions and organizations that have stepped forward and assisted and supported our teams, the divisional commissioner and the divisional health teams, to ensure that we get these facilities set up and ready for our response to an outbreak. To conclude, a reminder, wash your hands 20 seconds using soap and water. Cover your nose and mouth when you cough or sneeze with tissue or using the inside of your elbow. Practice social distancing, 2 meters wherever you are, whatever you do. Make sure you are 2 meters away from the next person that you are with. And finally, if you have any concerns, you're worried about your status with the COVID-19 disease, please contact our toll-free line 158 and get responses to your queries and make sure your doubts are settled. Thank you very much.